Okay, so thank you for coming. Today's topic is COVID-19's second wave and what business owners should know. There's a lot of material to cover. I'm going to go pretty quickly through several different subjects, so please bear with me. The idea is not to give you specific answers on what to do in each instance that might appear in your workplace, but to give you a general idea of the considerations that you should be looking for and where to go for information. So hopefully this is all very helpful to you as you navigate the next few months. And here's my disclaimer I get for every presentation, which is that I can't give specific legal advice to you in a context like this. So this is just informational purposes that I'm providing this information. It's not legal advice. For those of you that don't know me, my name is Jamie Bossuat, and I am a shareholder and employment lawyer at Kroloff. I do both employment law and business law, and my firm also offers a variety of other services, but those are the areas in which I focus. For my clients, I provide policies and guidance with legal compliance. I do sexual harassment trainings and other trainings, and I assist them in claims brought by employees or other litigation all the way through trial for my clients. So what we're going to go through today are the new stay-at-home orders, of course, safety guidance that has been issued by the state that businesses need to follow, how you would respond to an exposure in your workplace, and then what is currently in place relating to your obligations for employee leaves of absence relating to COVID. So just the first slide, we all probably know this already, but the current CDC symptom list is here. Cough, shortness of breath, or difficulty breathing is the most common symptom. Fever or chills, muscle or body aches, vomiting or diarrhea, and a new loss of taste or smell. So those symptoms cover a wide variety of different illnesses you may have, including the common cold. So it's a little bit difficult to differentiate, and a lot of people are getting tested now because they are developing these symptoms. So the new stay-at-home order, I don't know why that says something funny, but anyway, the new stay-at-home order has been issued. So this is an interesting order because it's regional rather than county by county. The levels that are still in place and active, we'll go through in a moment, those are county by county, but this is by region. So we are in the San Joaquin Valley region, which is in the center there. This is updated daily. I pulled this down off of covid19.ca.gov. So all of the blue counties currently have modified stay-in-place orders active. The Bay Area and Northern California regions do not, but the Bay Area counties individually have elected to put stay-in-place orders in place. So if you're operating outside of San Joaquin County, you want to pay attention to what's in place at any given time in those other counties as well. So the current stay-at-home order requires the following sectors to close completely: hair salons and barbershops, personal care services, museums, zoos, and aquariums, movie theaters, except for drive-in, wineries, bars, breweries, pubs, and distilleries, except for production for off-site consumption, family entertainment centers, card rooms and satellite wagering, limited services, live audience sports, and amusement parks. So those are closed. The following, according to the order, the following sectors have additional modifications. I have two slides on this. So first is outdoor recreational facilities. Those are only allowed to operate for the purposes of facilitating physically distanced personal health and wellness through outdoor exercise without food or drink or alcohol sales. Overnight stays at campgrounds are not permitted. Retail and shopping centers have to operate at 20% capacity and 35% capacity for standalone grocery stores. There has to be metering at the entrance and there can't be any eating or drinking in the stores. Also, the order requires special hours for seniors and others with health conditions or compromised immune systems. Hotel and lodging is extremely limited, only for the purposes listed here: COVID-19 mitigation, which would be individuals who are arriving in the state and quarantining for 14 days, and accommodating essential workers or providing housing solutions for homeless populations, something COVID related. Restaurants are for takeout and delivery only. Now, I want to say that this is pulled down just a few minutes ago off of the california.ca.gov website, which is listed on the bottom of the slide before. I should say, if you want a copy of the slides, send me an email and I will send you a copy. If you send me a chat, it disappears when I close the webinar, so don't do that. Please send me an email. My email will be at the end of the presentation. So COVID19.ca.gov has if you scroll right down below this map, you will see a list of what is closed and what the sector modifications are. Those have changed just this week. They change frequently. Playgrounds used to be closed, they're now open. So you're going to want to check this fairly regularly to make sure there's no change that might impact your industry. Offices are closed except for remote only and for critical infrastructure sectors where remote working is not possible. My next slide will talk a little bit about what is a critical infrastructure. Places of worship and political expression are for outdoor activities only, and then entertainment and production are allowed to operate without live audiences. These businesses can remain open where a remote option is not possible. That's critical infrastructure, schools that are already open for in-person learning, non-urgent medical and dental care, and childcare and pre-K. So I think it's important to note that this stay-at-home order is significantly different than the one we saw in the spring, when everything closed very rapidly without any guidance on how to be safe. There was a lot of unknowns regarding how the virus spreads, what should be done in businesses to keep people safe. Now we have a mask order, we have guidance from businesses, which we're going to go through. And so a lot more is remaining open now than did previously. And that's because now we know more and we are able to keep things open in a safe manner. And that's what Cal OSHA is going to expect of you when you're running your business. We're going to go through that as well. So this is the essential workforce list. It's up on the CA.gov COVID-19 website. I have the link there at the bottom. So you can click on each sector and see whether your business is essential. This was updated December 3rd, and it is different than the one that was issued in the spring. Very similar, but there are some differences, and it has expanded. So do take a look at that if you're not sure whether your business is essential. So here's an example. If you click on one of these, what you see, it's a sector profile and then a list of the essential workforce if remote working isn't practical, and you can see the long list there. So for example, our office cannot run completely remote. We receive a lot of mail. We have hard copy filings that have to go to some counties, etc. We do notaries for people changing wills when they are ill. All of that cannot happen remotely. And so we are working from home to the extent we can, but we are also operating in the office on a limited capacity with precautions in place. So this is the tiered approach. I'm going to go to the next slide. You remember this from before: widespread, substantial, moderate, and it affects who can be open when. That still exists. So as soon as the stay-at-home order is lifted, it's in place for 3 weeks. You have to have 15% ICU capacity in your region in order to reopen. We're at 0. So I don't know if the 3 weeks is reasonable. We might be a lot longer than that because cases just keep increasing. If you go to our county health department website, you can see the cases in our county. Our ICU capacity exceeds 100% at this, or our ICU capacity is below 0 at this point. So, and the county itself is at 0, or the region itself is at 0. So once we have further ICU capacity and the number of COVID cases in the hospitals is reduced, we're going to go back to this. And this is the tiers. So this was the prior, this is the map from today. So you can see just a few weeks ago before Thanksgiving, California was mostly red and orange, and now we are back to almost exclusively purple. So that is based on the amount of these metrics: positive cases per day, positivity rate, and ICU capacity. So you can see the state as a whole only has a 9.9% ICU capacity right now. So on these tiers, when you go to the covid19.ca.gov website, if you type in your county, it gives you a list of all of the sectors that are closed or open. So that's still in place, and that's what we will go back to. So here I have a copy of it. So you enter your county, and then there's a drop-down list to see what's open, and then it will give you details on that particular sector. So if you are concerned that you're wanting to operate within the state's guidelines, this is what you would look to. People can make complaints that businesses aren't following precautions to our public health authority, and they are taking action in our county. And I'm aware of businesses that have been closed for a period of time because precautions were not implemented. So we have health department and county-wide enforcement, and then we also have Cal OSHA enforcement, which is employee safety. So we're going to go briefly through the isolation recommendations and quarantine recommendations. Isolation is for those who have tested positive or have COVID-19 symptoms. Quarantine is for those that have been exposed but have not tested positive. So the isolation precaution currently from the CDC is that you can discontinue isolation 10 days after the onset of symptoms if your fever has resolved without medication, and if your other symptoms have improved. They don't have to be disappeared, because sometimes there's a lingering cough or something else, but they have to have significantly improved. Now, if you had severe illness, this isolation period could be extended up to 20 days. So if you're talking with others and trying to figure out what's going on with your employees, this is helpful information, because if they come to you and say, my doctor said I have to isolate for 20 days, you know that that's reasonable. Now, those who have an exposure but have recovered in the last 3 months and remain without symptoms do not need to isolate further. A test-based strategy is not recommended, but is used by some physicians to end quarantine or isolation early. Retesting is not recommended for those previously diagnosed. Some people recover and are not contagious, but they still test positive. So they can be returned to the workforce even if they have are testing positive because the symptoms have resolved as indicated above on the slide. These are the quarantine recommendations. So if someone has been exposed to a person who has tested positive, the recommendation all along has been 14 days of quarantine after the last contact with the person, and then monitor for symptoms. A close contact is what we look for when we're deciding whether someone has been exposed. And that's someone who was within 6 feet of a COVID-19 positive person for 15 minutes or more, provided care to them, had direct physical contact with them, shared eating or drinking utensils, or if they coughed on you or got respiratory droplets on you. So this is 15 minutes or more within the 48-hour period of the onset of symptoms or the positive test results. That's the contagious period according to the CDC. We're going to go through that in a little more detail when we get to the slides about workplace exposures. The CDC last week issued options to reduce quarantine because the vast majority of people who test positive do so within 5 to 7 days or by within 10 days. So the average is 5 to 7 days, and most test, I think it's 90, I don't know, a very high percentage test positive within 10 days. So there is this option to reduce quarantine, and some health departments and officials and physicians are adopting that recommendation. So don't be surprised if you see that from workers in your workforce. And I have the link on this page where these websites did come from. It's the CDC website, but if you Google CDC quarantine recommendations, you'll pull up this website. Also, this was a screenshot from that website. Also, you will want to check this regularly because, like I said, it changed last week. It changes all the time. So if you have an exposure in your workplace, if you have been exposed, you want to go to the website and see what the current recommendations are. The California Department of Public Health website has been following the CDC recommendations, but you can also check there. Okay, we're moving on to workplace safety, but I did have a question, so I'm going to take a look at that. Okay, so we have this question that I was just reading is about leave, and we are going to address that question later in the presentation. I have another one. Okay, there we go. Okay, moving on. Unless there are other questions about what we just covered, which I will take now. No. Okay, very good. We're going to move on to workplace safety guidelines then. So the Workplace Safety and Health Act governs safety in California. This is what Cal OSHA enforces. All employers must provide employees with a place of employment free from recognized hazards. There's stuff in front of my screen that are causing or likely to cause death or serious physical harm. So that's what governs every workplace, and that's what we're operating under. And COVID-19 is now a recognized hazard. So we have an obligation as employers to protect against it. Every workplace must have an injury and illness prevention plan. This has been the rule in California for many, many years, but it's at the forefront of everyone's minds right now. So the IIPP has to be updated, and employees have to be trained when a new or previously unrecognized hazard is identified. So that is COVID-19. So many employers have already put in place COVID-19 plans, but you also have to have an injury and illness prevention plan. The Cal OSHA website has a sample if you want to go through that and try and set one up. We also write them for our clients, or you can reach out to your own attorney, but we also provide that service. State guidance for reopening. So this was issued at the beginning of the pandemic, or well, not the beginning, but I'd say, was it in June, I guess? I can't recall exactly. But it requires that when you reopen your business after a closure and are beginning to operate, that you go through these steps, that you perform a detailed risk assessment and implement a site-specific protection plan, that you train your employees on how to limit the spread of COVID-19 and how to screen themselves for symptoms, how that you implement individualized control measures in screening in your workplace, that you have disinfecting protocols, and that you have physical distancing guidance in place. For each industry, California on the covid19.ca.gov website has a general checklist and then a more thorough document as well about what should be in your plan and what you need to do in your workplace. So if you are following these guidelines, if a Cal OSHA inspector appears in your workplace, you're going to be in pretty good shape. Also, just recently, a few days ago, a week ago, Cal OSHA issued emergency temporary standards, which duplicate in a lot of respects the COVID-19 guidance. Both are Cal OSHA documents, both are being enforced. So in the middle there, you see the link, COVID-19 Model Prevention Program. So that you can click, it brings you to a Word document that you can modify for your own workplace. I wrote COVID-19 guidelines for a lot of workplaces back earlier in the year. And those mostly still meet the requirements of OSHA, but you might want to take a look at this and update them. Or if you want to reach out to me, I can update your plan now that we have some new guidance. But what you're going to want to do is evaluate your workplace, evaluate what the sources of COVID-19 exposure are: customers, coworkers, the general public, what risk factors exist in your workplace. You're going to want to evaluate what can you do to prevent that spread from each of those persons: physical barriers, reducing head count, different protective equipment that might be appropriate for your workplace, routine cleaning, and then what happens if you have an exposure, which we will go through later. So cleaning and disinfecting is recommended in the workplace. So stepped up cleaning should be part of your plan. That includes high touch surfaces like doorknobs and light switches and cabinets that are touched regularly. Also, it's recommended to avoid sharing work supplies and equipment. Headsets, pens, pencils. We have sanitizing supplies by our copy machine, for example. You wouldn't want someone to sneeze on that and the next person to come up and touch it. So when you identify your hazards, you could put in place mechanisms to clean and disinfect. Your janitorial, if if you're using a company, is going to hopefully be recommending to you some options. If not, you can reach out to them. Okay, I got another question which we will address shortly, so I'm going to hold that one on employee returning to work. Okay, so employee training, the guidelines do indicate for each industry what employees should be trained on, information on COVID, how to screen themselves, that they should be staying home if sick, when they should seek medical attention, the importance of hand washing, the importance of physical distancing, and how to use proper protective equipment, including masks, which isn't actually personal protective equipment. There's a definition for that, but I think you should train on mask use. They should be clean each day. If they get wet, they should be replaced, etc. The CDC has some links and handouts on all of these different training aspects that you can use. So you'll want to identify symptoms in your workplace. Employee screening would include taking temperatures. You can have your employees take their own temperatures each day before coming to work. It's a good idea to have a thermometer if someone feels ill at work. You want to screen for any travel to infected areas. This was more important earlier. Now everywhere is basically an infected area. Exposure to someone who is tested positive and any of the CDC identified symptoms. And then you want to screen your guests also. So if when making appointments, tell them that they should alert you if they have any COVID-19 risk factors and reschedule their appointment or make it remote. Those of you who are subject to the California Consumer Privacy Act should be aware that when you're taking this kind of information from your clients or your customers, it may require a supplemental disclosure. Okay, responding to an exposure. So you'll need to take these steps if there's an exposure in your workplace. Isolate the employee with the confirmed or suspected illness. They should be sent home, and you should question them so you can do an investigation into possible spread in your workplace and the source of their infection. You want to then isolate any employees or customers who may have been exposed. You want to notify other employees and potentially customers within 1 business day. We're going to go through the notice requirements later. You investigate, I already said, take disinfecting and cleaning precautions with regard to that person's workspace, and then contact your workers' comp carrier, the county health department, and potentially Cal OSHA if requirements are met for those notifications. So an isolated or infected employee should be directed to follow the recommendations of their healthcare provider. I do recommend that you not have them return to work unless they're released by a physician. Cal OSHA doesn't allow them to be returned to work with a negative COVID test. That cannot be the requirement, but you can ask for a doctor's note. And the reason I recommend this, of course, it's always on a case-by-case basis. If you have an employee that can't get a doctor's note, you're going to want to consult counsel probably. But the severity of the illness impacts how long they should isolate. And so that's something that I think requires the guidance of a healthcare provider. I have the link again to the isolation guidelines here as well. Those who are exposed should be asked to quarantine and not come into the workplace. Someone who is within 6 feet for more than 15 cumulative minutes within the 48-hour period before the onset of symptoms. So when you interview your employee who has tested positive, that's what you're going to ask for. When did your symptoms develop, or when did you get a positive test? Who were you within 6 feet of during that period, and for how long? And so it's 15 minutes within a 24-hour period. So it could be I was in Sue's office 3 times, and I was there for 5 minutes each time. And I was helping her with something on her computer, so I was within 6 feet. Sue has a close contact. Sue was exposed. Sue needs to receive notice. We're going to go through the notice. Clean and disinfect the workplace. Close off the area used by the sick person. Wait 24 hours to clean and disinfect if possible. Open doors and windows. Disinfect office areas as well. Most workplaces are doing this on a regular basis in the evening anyway, as part of their COVID plan. Use CDC approved cleaning products. I have a link on a slide here. This comes from the CDC website, Disinfecting Buildings. I think I have the link there on the bottom. If it's been more than 7 days since the infected person was in the workplace, this happened over Thanksgiving a lot. People took time off and then they tested positive. Well, they haven't been in the office for 7 days, so no cleaning is necessary. Oops, this changes, by the way, too. Check the CDC website if you have an exposure to make sure what the current recommendation is. It's changed over time. Notice requirements. Written notice has to be given to all employees and subcontractors who were exposed within the infectious period. You might also want to consider notifying third parties like your customers. You have to provide written notice to representatives, including unions or any attorneys involved in representing employees. You want to give written notice of these things: COVID-19 related benefits that your employees may receive, including workers' comp, COVID leave options, paid sick leave options, and the company's anti-discrimination, anti-harassment, and anti-retaliation policies. Also, you have to include notice of your company's disinfection protocols and safety plan. So this is quite a bit of information to provide within 24 hours. So my recommendation is that you prepare this in advance. If you need assistance in doing that, that's a service that we provide to our clients. I prepare these notices, but you can contact an HR consultant that you might be using or an attorney, and they should be able to assist you with that. So if Cal OSHA guidelines are met or local health authority guidelines are met, you have to contact them regarding an outbreak. That is the link to the reporting requirements in California right now. And that is a link to the California Department of Health's definition of an outbreak. It changes over time. Also, always contact your workers' compensation carrier. There is a presumption that COVID-19 was contracted in the workplace. So if you want to rebut that presumption, you need to give that information to your carrier quickly. Cal OSHA has issued emergency rules. This requires that local public health agencies be contacted within 48 hours if there's enough to constitute an outbreak, and the link is there. Also, Cal OSHA has changed the process by which they issue serious citations. So it is important, if you have a Cal OSHA inspector or contact, that you contact counsel, I would recommend, so that you can get as much information to Cal OSHA as you can to combat and fight a serious citation before it's issued, because that process, there's no longer a process where you get to submit additional information before the citation is issued after they give you notice of it. Now you need to get that information to them at the outset. And yes, I do recommend contacting counsel if you have a Cal OSHA inspector at your workplace. Also, about a week or two ago, the Cal OSHA temporary COVID-19 standard was issued. That covers, it doesn't cover employees working from home or single employee employers, but it covers everyone else. Now you have to offer COVID-19 testing to those with a potential exposure. That's covering out-of-pocket costs for the employee and allowing them to do the testing during work hours. You have to provide notice to independent contractors under this standard. You have to track and record all of your COVID-19 cases with employee name, contact info, work location, date of last day at workplace, and date of positive COVID test. This is information you should be collecting anyway, so that you can do your contact tracing and identify any exposed individuals. But now it has to be recorded and made available to employees and authorized union reps. Could be redacted. It should be redacted for employee privacy, however. You have to evaluate whether you need to provide respiratory protection and whether the Cal OSHA respiratory standards apply to you. If physical distancing isn't possible in your workplace, that would be N95 masks and other respiratory protection. This is a very stepped up standard. So if you cannot maintain physical distancing, you're going to want to look into that and make sure you're complying. Employers have to, this is a big one. I don't know if this is going to stay in place, but right now, continue and maintain earnings, seniority, and other employment benefits when the COVID-19 was contracted in the workplace. Now, this could be just a supplement between what disability pays and regular pay. So you can consider benefits when you're deciding whether you're maintaining earnings. And FFCRA leave would count in here as well. And then this increased outbreak reporting requirements, which we went over on the last slide. And if you provide housing to your employees, there are some additional requirements. So penalties for violation of this Cal OSHA standard are hefty, from $13,277 to $25,000 for an initial citation, and repeat offenses, the maximum is $132,765. So there is a lot of risk here in the event of a Cal OSHA inspection and citation. So here, for example, is just a sample I pulled down off of the Cal OSHA website. They publicize some of their citations in an effort to deter others from violating the standards. So these are grocery stores in Southern California, but you can see one was initiated by an accident. That's probably a COVID-19 hospitalization or death. Most were complaint initiated, and one was referral initiated, which means it came from another agency. So these are hefty citations right here, but they were for a variety of reasons involving failure to protect workers from COVID-19, not updating workplace safety plans, for example, not properly training employees, not putting enough preventative measures in place like plastic barriers, and not maintaining 6 feet of physical distance. So all of those are going to be risk factors for a Cal OSHA citation. All right, we're going to go over COVID-19 leaves of absence. A single employee employer. That means you have only one employee, or you are yourself the employee, a sole practitioner. If you would like to receive a copy of the slides, please send me an email. If you put it in the chat, it disappears when I close the webinar. So send me an email and I will get you a copy of the slides. And also, I'll repeat again, for those of you who are attorneys, if you would like to receive MCLE credit, please send me an email with your bar number and I will get you the appropriate forms. Okay, so employees returning to work after testing positive. I got that question. So what I do recommend getting a doctor's release to return someone who tested positive, but you can also follow the CDC guidelines, which is the 10 days after resolution of symptoms. And so you have those two options. Requiring a doctor's note is a little bit safer, but requires some additional hoops to jump through. You cannot require a negative test. Also, for healthcare workers and other essential workers, there is another standard that is on the CDC website and that is endorsed by the state of California for returning someone who is exposed but not positive to the workforce earlier with precautions in place. So that relates to healthcare workers. They're having exposures constantly. So that goes through if they were exposed with a mask, with precautions in place, without a mask, et cetera, and what the recommendations are. So if you have essential workers, you're going to want to check that out. If you would like a copy of the slides, please email me. The chat is going to disappear when I close this webinar and I will not have your message anymore. Okay, employee leaves of absence. So the Families First Coronavirus Response Act was in place for those with less than 500 employees from April 1st through the end of the year. I get the question all the time, will it be extended? It is part of the current discussions that are ongoing in Congress. I would have said that it was likely to be extended because it was passed with broad bipartisan support in the spring. And at the time, it was thought that the pandemic would be resolved by now. That was apparently wishful thinking. And we are now looking at the pandemic stretching well into next year. So I would not be surprised if it was extended. Congress, however, is not the most functional body ever, and they don't move fast. So I'm going to hold my breath. We'll see. So right now it goes through December 31st, but I think you should be prepared for something to be in place next year. So let's see. It provides 2 weeks of emergency paid sick leave up to 80 hours for an employee who is quarantined or experiencing COVID-19 symptoms and seeking a medical diagnosis. This is paid at $511 per day. If they are unable to work due to care for an individual who is subject to quarantine or whose school is closed, that's 2/3 of their pay, $200 a day, and up to 2 weeks. So this paid sick leave covers everyone with less than 500 employees. Then there is expanded family medical leave, which is the second part of this. So this is caring for someone else or for a school closure. It provides 12 weeks of leave. 2 of them are unpaid. So employees can elect to overlap these two and do 12 weeks of paid leave for care for someone else. But if they've used the 2 weeks up on their own exposure or symptoms prior in the year, then they cannot get the full 12 weeks paid. 2 would be unpaid. So they'd get 14 weeks total, 2 of which would be unpaid. So payroll companies are processing this. It's built into all the software programs at this point. You indicate what type of leave it is, and then this is reimbursable through payroll tax liability. So the payroll companies will reduce the amount of payroll taxes that you owe for each week in which you submit that someone is on this type of leave. There are FAQs on the IRS and Department of Labor websites on how to implement this. There's a non-retaliation provision in this. There's a requirement to reinstate someone after they take leave, and you can't require someone to find a replacement. And like I said, this is reimbursable. Your payroll taxes are reduced. If you pay out more in FFCRA leave than you owe in payroll taxes, you get a refund check from the IRS. You need documentation in the event you're audited because of the payroll tax reimbursement portion of this. So you need to get a statement from the employee in writing about the things indicated on this slide. I'm moving along. We have enough time here, so I'll go through these. The employee should provide the name of the governmental entity that issued the quarantine order. They should provide the name of the healthcare provider who advised them to quarantine. If they're experiencing symptoms or seeking a diagnosis, that statement alone is sufficient, and you just want it documented. If they're caring for an individual, you want the name of the individual, the relationship, and the government entity or healthcare provider. If the school is closed, you want the name of the school, the age of the children, or the child care, and that the person or person providing childcare or the school is closed due to COVID-19 reasons. This applied more and was confusing during the summer because schools weren't closed to COVID-19. They just were on break. That's going to happen in December when schools close again for the holiday. If school is closed because it's a holiday, that is not time that should be paid under the FFCRA leave. You wouldn't have sufficient documentation to survive an audit in that event. If the child is over 14, you need an explanation from the employee as to why they need supervision if they're at home learning. School closure includes at home learning. I am recording this webinar, and it will be posted both on my firm's website and on the Greater Stockton Chamber of Commerce website, I believe. Okay, and you have to have that they're out because they can't work due to COVID. And then I also recommend maintaining documentation on how you calculated the rate of pay in the event you get a claim from an employee that they were paid incorrectly. There is on the Department of Labor website, an FAQ that goes through how to pay. It is actually quite complicated if the person isn't a regular hourly employee who always receives the same pay. And so you'll want to check that out, make sure you're doing it correctly. This is something I advise my clients on, how to implement the FFCRA, who qualifies. I get questions about this quite a bit. It only takes a few minutes to answer them usually, but then at least you know that your liability has been reduced. There is an exemption for this. I haven't had a client use it. Financial hardship, if granting the leave would cause the business not to operate at minimal capacity. Highly skilled or knowledgeable employees, there's an exception for them if their absence individually would cause the business not to be able to operate. And then lack of replacement, that worker isn't especially skilled or unique, but you can't replace them, and you need that volume of employees to continue operating. Those are very risky, might I say. Most of the claims we see arise from failure to grant leave. And so you want to be very careful and make sure you have adequate documentation to deny leave. If you're going to deny leave, I really do recommend contacting counsel. California issued a law this year out of the legislative session granting supplemental paid sick leave. So they extended the federal law's requirements to those with 500 or more employees. And also there was an exemption in the federal law. There is an exemption for healthcare workers that California eliminated. I do recommend using the federal law if you're a healthcare provider because it provides that wage replacement out of the tax. California doesn't have a similar reimbursement. So why not use the federal law and get that reimbursement, in my opinion. There's also an extension for food section workers that are allowed to hand wash for every 30 minutes. If the paid leave is given through the California law, it needs to be on the wage statement. And like I said, it applies to healthcare workers. Okay, I have a question. After having 2 positive cases, should I report the cases to the county? We have a total of 75 employees. You know, honestly, I didn't look up. I think it's 3 or 5 over a certain period. So I don't remember though. So don't listen to me. I'm sorry. You want to check out that link and see what the current recommendation is for an outbreak that needs to be reported. Can an employee use the 80 hours for seeking diagnosis and then use the 80 hours of unpaid leave, or is it one of the other? It's one or the other. It's a total of 80 at full pay. And so when the employee comes back to you again and says, I have another reason to be out, then you give them the 2/3 pay under the family leave portion of the law. We do have to take note of how this interacts with your existing paid leave benefits like sick leave, vacation, or PTO. So this slide goes through that in some detail. Paid sick leave has to be provided, the Emergency Paid Sick Leave Act law, the FFCRA portion, paid sick leave, is first. Employees get to use that before using other types of leave. You can't require them to draw down all of their sick leave through your business before taking this. However, if the 500 is less than your employee normally receives, you can agree to supplement up to their regular pay if the employee wants to do that. And California paid sick leave can apply to an exposure or self-quarantine or care of a family member. The Department of Industrial Relations and the Labor Commissioner clarified that. So if an employee has used their existing leave, use the federal leave, then they can go ahead and use whatever you have in sick leave. So for the family leave portion of the federal law, the first 2 weeks, the employee can elect but can't be required to take paid sick leave, but they can agree to supplement or to use your other available leave under the policies. Now for the remaining 10 weeks, the employee can, that's for family leave, the employee may elect or be required to take the remaining leave. And so this is how this overlaps is quite complicated. So if you do have a question about it, if you're not sure how it overlaps, or if you can supplement, or if you can require someone to draw down leave, that's a question that you should be asking your counsel because it's a risky area. Also, it's important to note how this applies in conjunction with Family Medical Leave Act and with California Family Rights Act. So this was a general COVID presentation, and I really don't have time to go through all of the details of California Family Rights Act, which goes into effect for employers of 5 or more in January. So remember that, update your policies, and FMLA and disability leave, et cetera. But you want to be aware, if those apply to you, how they are affected. So for example, if someone has COVID themselves and they are seriously ill and hospitalized, that's going to count as a serious health condition under FMLA and CFRA. So they could be drawn down consecutively. If they are caring for a family member that has COVID, however, it might not. So that's just something to be aware of. Or particularly school leave is not covered by CFRA or FMLA. So they would be able to take leave under FFCRA and then have their full entitlement to FMLA and CFRA still available. So it's important to track all of these different kinds of leave. So also, I always like to note that the Americans with Disabilities Act and the Fair Employment and Housing Act apply to COVID-19 or another health condition someone has that exacerbates COVID-19 or puts them at higher risk for COVID-19. So employees may take all of the paid leave available and all of the protected leave available and still need to be out of the workplace. And you need to evaluate that as a reasonable accommodation. You can't just terminate at the end of the 12 weeks. You need to evaluate whether this person has a disability that should be accommodated and whether it would create an undue burden. Now, accommodation doesn't necessarily have to be time out of the office. It could mean placing someone at a different location that's less risky. If they have a respiratory illness, for example, or condition, their doctor may ask that they not be interacting with the public or that they be moved to a less populated area in your building. So there are a lot of accommodations that could be granted with someone with a health condition that you're going to want to evaluate. Okay. Oh, I've reached the end. So we do have about 10 minutes for questions. So if you have questions, go ahead and ask them and I will try to answer them. Are the 80 hours of paid sick leave to be taken consecutively? No, they do not need to be taken consecutively if it is to care for someone else. Now, if the person has COVID-19 symptoms, they need to be taking that and you could require that they take it consecutively because you're not going to want someone who has COVID-19 symptoms coming into the office one day and then home the next day and then back. That's an exposure risk. That's bad. Don't do that. So you're allowed to require that someone for their own illness take it consecutively, but for other reasons, they need not. So for example, there are some schools that are open for in-person learning 3 days a week. So those 3 days would not qualify for the FFCRA leave, but the 2 days where the school is closed and they're doing distance learning would. So an employee can ask to take that not consecutively. What do you suggest employers do if Congress fails to extend the FFCRA? You're going to want to evaluate whether the state law applies to you. It actually was written to coincide and terminate on December 31st also. It goes as long as the FFCRA goes. So it's also going to terminate. I think California is more likely to extend theirs than the federal government. So we'll have to wait and see. And then you're going to just want to see what other laws are in place that apply to you that would apply to a COVID-19 illness. Does the California Family Rights Act apply? That is now applying to 5 or more employees, employers with 5 or more employees. That's I have to just note, if you haven't updated your handbook this year, you need to. That law changed. It applies to every employer with 5 or more. Even if you had 50 or more and you already had a CFRA policy in your handbook, the definition of family member has changed. So that does need to be updated. I'm doing a bunch of handbook updates. I still have time to squeeze more in if you need one done, but be aware of that. And that law will apply to anyone with a COVID-19 illness or family member with a COVID-19 illness that qualifies as a severe illness. So you need to go through that and look at that if these laws do expire. What if an employee recovered from COVID-19, but a member of their household has an active case? So what I've seen is that the recommendation from the healthcare providers is that they continue to quarantine because they're continually being exposed. But actually your question said they've recovered. So they have an immunity for a certain period of months. In that instance, I would ask for a doctor's note that covers you and protects you and gives you more guidance on the health conditions that are actually going on. If you want to receive a quote for a handbook update, I would ask that you email me. These chats are going to disappear and I don't have your email address in the chat and I won't be able to get back to you. So if you could please go ahead and send me an email. My email's on the screen. That would be great. Will there be a recording sent? The recording will be posted on my firm's website. So you can go and check that out within a few days. If you have trouble, just email me and I will help you out. Okay. What relief will be available to employees in 21 if Congress does not extend? It's just going to be the laws that are already in place. You would treat it as though there was a regular illness in 2019. It's just more likely that people will have an illness. Also, we're requiring employees to be out more. I do not recommend that you let an employee with a cough come to work. That is a COVID-19 symptom that violates Cal OSHA rules. If they swear up and down that it's just a cold or it's allergies, that presents a risk to you. So ask for a doctor's note, ask for them to get a negative COVID test to return to work. Like I said, you can't require a negative COVID test, but they could volunteer to get one. But you want to be really cautious about people with COVID-19 symptoms. So people are running down their sick leave a lot faster. So you're really going to want to evaluate what you need to do in that instance, consult with counsel if you're going to discipline someone or terminate someone for running out of leave. Okay, if we have an outbreak and need to do weekly testing, how do we handle doing that with HIPAA laws? Can we do testing on site with kits, or do we need to send them to an outside testing location? That is beyond the scope of what I can do in this context. You need to work with the county health department's requirements in that instance. You can do testing on site. HIPAA laws do apply. So you need to be careful about that, how you're maintaining that information, who has access to it. If you have an exposure, you cannot tell other employees who was exposed without the consent of that employee. That would violate their privacy rights. So you can say, my notices that I write for employers say, we believe that you were in close contact with an employee who has tested positive for COVID-19. It doesn't include the name. Now, if you have a small place of employment, people are going to figure it out. There's one person missing, right? But there's nothing you can do about that. But you cannot disclose their name. Okay. If an employee, hold on, tests positive. If an employee tests positive at one site, is the employer required to tell staff at other sites? Not necessarily. For each positive test, what you need to do is do an investigation into where they think it was contracted, if they know. If the husband is sick, then that's pretty obvious, and who they had a close contact with in your workplace. So if they stayed at their site, they probably didn't expose anyone at the other site. So the notice for those employees would not be mandatory. However, gossip occurs and that information spreads. Oh, Bob has COVID, and everyone starts to panic. So I do have a lot of employers that take preemptive steps, and they say, it's not the notice that's required by law, but they do send a notice that says, you may be aware that someone in our workplace has tested positive. We want to reassure you that we are taking all required steps to address this. Everyone who had a close exposure has been notified. We have no reason to believe you had a close exposure. These are the extra cleaning steps that we're taking. Remember that we have all of these COVID-19 precautions in place. Please work with us to follow them. We believe our workplace is safe. So that's what you want to do to reassure your workers. That's not required, but I do have employers that want to do that to reduce panic. We see these news articles where there are outbreaks and the employees are always up in arms that they weren't told. So there's what the law requires, and then there's people management. If someone exhausts their FFCRA, FMLA, CFRA, and have been out due to a positive test with a pre-existing condition under ADA, how long can their medical provider have them out for and be job protected? The ADA, Fair Employment and Housing Act, does not have an outside limit. So the physician can put them out for as long as they want. And you would want to engage in the interactive process with them, document that, and go through, is there anything we can do to get you back to work? Is there any way that you can work partially from home or completely from home? Is there any way that you can perform your essential functions despite the disability? And so if you need assistance with that, I do recommend that you consult counsel, because ADA FEHA claims for disability, discrimination, or failure to accommodate are a high risk area and create quite a bit of liability. Will the employees be reluctant to report if they have zero paycheck replacement options? Yeah, that's exactly why this law was passed. The law has been documented to prevent the spread and reduce the spread of COVID-19 because employees want to come to work so that they can get paid. So I do recommend, if you have an exposure, if you have employees that are concerned, the DLSE website and the EEOs, the EDD that provides disability benefits and unemployment benefits does have very handy charts about what benefits are available to those that are out of work. I do recommend sharing those with your employees, because if they don't have any paid leave through FFCRA, if they don't have any paid leave for you, they can apply for disability and receive disability benefits potentially. What do you advise when the CFRA expires that you tell employees? I just recommend taking everything on a case-by-case basis. If an employee reports to you that there's a need to be out, you then tell that individual employee, this has now expired. You're not eligible for it, but here's what we can offer you. Is an employee required to get tested if their child was exposed to positive COVID-19 individual? This is a question I get all the time. Secondary exposures. My child's school is closed because there was a child sick with COVID-19. I don't know if my child was exposed, but then was I potentially exposed? There isn't a requirement at this point in time that a secondary exposure takes someone out of the workplace. Now, you can be more cautious than the law requires, and I really do recommend evaluating those on a case-by-case basis. So what I recommend is that you do your tracking even for those. So when was your child last at school? When was the exposure? If my aunt was exposed, my aunt wasn't, but for example, and I saw her at Thanksgiving. Okay, when did your aunt develop symptoms? When were you last with her? Was it 48 hours before the onset of symptoms? You just want to go through that process with every single potential exposure. I got another question about paid family leave versus state disability. State disability pays an employee for their own illness. So their doctor certifies that, and they, even for a COVID-19 illness, would be able to get disability benefits. Paid family leave is to care for someone with a health condition. And I can't recall, it might have been extended for those that are required to quarantine, like caring for a child. I don't know, but there's a very nice table on the website for EDD for that. So I would recommend checking that out. If you Google paid family leave, EDD, and COVID-19, it pulls those up. Okay. If an employee has not used 64 hours and applies for SDI, should the employer pay him for the remainder FFCRA 64 hours? Yes. So whether or not the state is going to pay SDI is different from whether you owe someone paid leave. And they will have to report that on their earnings statement, and their disability will potentially be reduced because they have received pay from you. Okay, I think I answered all of the questions that were pending. Are there any more? You're welcome. Someone said thank you. Okay. All right. Just a reminder, if you are an attorney and you would like to receive MCLE credit, please send me an email with your bar number. If you would like to receive a copy of the slides, please send me an email and I will get those to you. If you want to watch this recording, it's going to be on my firm's website, and I am going to ask them to post it on the Greater Stockton Chamber website as well. And if you have trouble with that, email me and I will take care of it. I wish you all good luck as the pandemic goes on and just navigating all of these regulations that are constantly changing. I hope this was helpful to you and give you a very good overview of the different areas that businesses should be aware of and the resources out there to look to come into compliance. We're dealing with so much already. I don't want you to also have to deal with legal liability or claims or citations. So good luck to all of you Happy holidays, happy new year, and all of you, please stay safe. All right, thank you for attending.